I did.
You're good.
Okay, very good. Okay, so I did my research on school safety in the COVID pandemic, and that is something that we all went through this past year. So, there was all sorts of different sorts of measures and protocols that we had to follow and guidelines in order to keep our school safe. A lot of these protocols were designed by the CDC and then were given over to our school administrators. And so the administrators gave us these guidelines to follow from the CDC. So there were prevention strategies that help slow down the spread of COVID-19 that K-12 school administrators use to protect their teachers, staff, and students. The prevention strategies were consistent implementation of layered prevention strategies to reduce COVID transmission in school. The next one was consideration of indicators of community transmission to reflect levels of community risk, and then phase prevention strategies based on levels of community transmission. So those were the three areas outlined in the CDC. Next, we had some public health efforts that provided additional layers of COVID protection in schools. And I will talk about those here in just a little bit. But just to go ahead and start with the prevention strategies as outlined by the CDC. Number one, it was the universal and correct use of masks. So we all know that there were certain masks that were approved, certain masks that were not approved. So the ones that were not approved were the ones that had valves or were made of loosely woven materials. So they were suggesting that you get something that was of a cloth material that was tightly woven, and it had to come up over your nose and be tightly around your face and under your chin, so not to transmit the virus. And then for students that had disabilities, one of the things that this talked about was that if a student for some reason of a disability could not wear the mask, that they should be excused from doing so, that it shouldn't be required. However, that they needed to follow the proper physical distancing. But for everybody else, the mask was something that they had to wear all the time. The next one was the physical distancing. So I broke this down, and if you guys want, you can kind of follow along with the information that I gave you earlier. I sent in a email, but this was the physical distancing. So between students in classrooms. So we have the elementary schools, the middle schools, and high schools. And in elementary schools, the students were required to be 3 feet apart in levels of substantial or high transmission, and then cohorting was recommended. And I didn't exactly know what cohorting was, but that was just where they were put into distinct groups. So in the event that they had to do some sort of contact tracing, that they could go into just these distinct groups. Now in the middle and high school levels, students should be 3 feet apart in low, moderate, or substantial community transmission. Cohorting is also recommended, but in areas of high transmission in middle school and high school, students should be 6 feet apart if cohorting isn't possible, 3 feet apart if they cohort. Now, as far as sports and extracurricular activities were concerned, as far as physical distance, it had to be 6 feet apart or to the greatest extent possible for lower moderate transmission. And then for the substantial and high levels, the sport had to be held outdoors, and there had to be more than 6 feet of physical distance in order for the sport to happen. Between adults and staff members, the studies found out that the transmission was more likely to occur amongst the adults than between the students and the adults, which I also found to be very interesting. And so the guideline there was for teachers and staff members that they had to remain at 6 feet of distance from each other. And the only time that masks were allowed to not be worn was if they were eating. They also found that during activities of exhalation, such as singing, band, or sports, the activity should be moved outside to well-ventilated areas. And then in areas of common, like lobbies, gymnasiums, and auditoriums. Again, cohorting was also something that they said should be done. So that way, again, for ease of contact tracing, use 6 feet of distancing, remove non-essential furniture and maximize distance between students, which we all had to do, or at least I had to do in my classroom. Face the desk in the same direction, eliminate or decrease non-essential in-person interactions among teachers and staff, and limit visitors. So you didn't want people from outside of your community coming in. And if that was allowed, that they had to wear a mask and stay away from students within 6 feet of distance. In regard to transportation, for buses, the children were only allowed to be 1 child per row. Mask had to be on at all times, and the windows were said to be cracked, would be helpful to help ventilate the bus. The other thing that they did for physical distancing was to offer staggered scheduling to limit contact between cohorts, as well as direct contact with parents, and then to provide alternate schedules with fixed cohorts to decrease class size. So we all did that. The next area was hand washing and respiratory etiquette for students and staff. These are all pretty straightforward, and I think we all pretty much know these, but just to go over them real quick, wash your hands with soap and water for 20 seconds, or use hand sanitizer containing 60% alcohol. Cover sneezes and coughs with a tissue when not wearing a mask, and immediately wash your hands after blowing your nose, coughing, or sneezing. Have adequate supplies, including soap and a way to dry hands, or again, hand sanitizer, tissues, face masks, and no-touch trash cans available. Cleaning and maintaining healthy facilities was the next area. In my school, we had to clean our surfaces after every class. So I have kids that were changing classes all the time. So I had to wipe down all of my desks and the doorknobs and everything with proper disinfecting things. The other things that they said to do would be doorknobs, light switches, sink handles, toilets, drinking fountains, playground equipment, etc., daily or between uses. Again, ventilation is a big thing. So you want to increase the circulation of the outdoor air by opening windows in the classroom, ensuring that heating, ventilation, and air conditioning settings are maximizing the ventilation. To change the air filters as much as possible, use exhaust fans in the restrooms and kitchens, open windows on buses and transportation, and then close communal spaces like cafeterias, or stagger the use in between, so that way they can be sanitized before the next flow of students come in. Avoid any self-serve food or drink options, and then to make sure that water systems such as the sink and faucets are safe after a prolonged shutdown. The next section was contact tracing in combination with isolation and quarantine. So our administrators had to collaborate with the health department. Students, teachers, and staff members with positive results should isolate, and close contacts should quarantine. And the schools should report the positive cases to the health department as soon as they were informed. And then families should be notified that someone in the school had tested positive within that same day. Obviously, stay home if you're sick. So some of the symptoms of COVID was running a temperature, sore throat, cough, and like a cough or difficulty breathing is based on your normal baseline. Diarrhea, vomiting, and loss of taste or smell, and the severe onset of a headache, especially with a fever. Um, this report I also found interesting because it said that schools should have a flexible sick leave that enabled teachers and staff to stay at home when they are sick or be exposed, or caring for someone who is sick and have sufficient subs on hand. That was something that my school did not have a sufficient supply of. We couldn't find any subs. The next thing, isolation should be used to separate those who have tested positive. The school must conduct contact tracing and provide information to the health department. And close contacts mean someone within 6 feet of a person diagnosed with COVID for a total of 15 minutes or more over a 24-hour period, regardless if the person was wearing a mask or not. And they should be notified within 48 hours of a positive test result. That was something that I was confused about. I'll be honest. I thought that it didn't matter. I thought that was if someone didn't have a mask on. So I was wrong. It is regardless if they had a mask or not. And then to quarantine. So students sitting less than 6 feet apart from another student that tested positive for a total of 15 minutes or more should quarantine at home and get tested. And then again, if a student with disabilities is quarantined, the school is required to provide services consistent with the federal disability laws. Next, okay, so we know that we continue to follow these guidelines for the remainder of the 2021 school year, but we still don't know what's to come in the following school year, which I hope it will be much better than it was this year, because that was a little crazy. But some of the things that they're basing this on is that right now, youth under 12 are not eligible for the vaccine, so they still, at this point, don't know what the guidelines will be. But here, May 12th, the youth between ages 12 and 15 did come eligible for the vaccination. And then you're not considered to be fully vaccinated until you receive both doses of the vaccination. Let's see. The other thing that I found to be interesting, that there was something that said about health equity considerations. And though COVID was global and worldwide, it did have a tendency to affect some populations more than others. So for instance, the American Indian, Alaska Native, Black, and Hispanic people were disproportionately affected by COVID-19, as well as some of the less privileged families. And they were at a, what's the word I'm looking for? Disadvantage, because they simply might not have had the resources to be able to do remote learning. So that was something that they felt to be very important. And for those people, that the schools still had to provide a meal program. They still had to provide services for education, counseling, or after school programs. So that was, something that was very difficult to maintain during COVID, but that was one of the requirements that schools had to follow. So I can imagine that that had to be, really hard and time consuming for the administrators during that time. Now, I told you earlier that there were some public health efforts to provide additional layers of COVID protection. And those are testing to identify affected individuals and limit transmission, and then vaccination for teachers and staff as soon as possible. So they wanted that the schools have those in place. Now, some of the schools, like in my school, we don't have a nurse or somebody that can administer those. So they asked that schools would refer out. So if somebody came in that had been exposed, then they referred those individuals to go and to get tested elsewhere, and that they would take over the tracing from there and contact the appropriate people for that. Let's see. And then also, sorry, I'm kind of going back and forth. I'm trying to look at my paper here. The school administrators had to work with the public health officials to assess the level of community transmission to understand the burden of the disease and make informed decision. And so there were two measures of community burden to determine the level of risk. So the total number of new cases per 100,000 persons in the past 7 days, and then the percentage of positive COVID testing during the last 7 days. So that was what gave us the low, moderate, and substantial and high risk areas. So that was used to determine the phases that we had to go through for COVID. And then let's see.
Okay, so Jennifer had lots of great points about COVID safety protocol, which was very lengthy, very extensive. Just in every school building had something different going on. And really, COVID, we don't know the long lasting effects and the trauma that it could possibly cause amongst staff, amongst students, amongst really anybody. In my building, we had training about how we will not see the trauma side effects of COVID for 10 years.
Oh,
So
wow.
our students right now, we won't really know the long lasting learning trauma from COVID specifically for probably 10 years. So that was really interesting kind of PD thing that we did. So I chose the topic of trauma for how to teach or how to deal with students who have dealt with trauma. Just because I had quite a few students who had IEPs, and most of them came from kind of a disadvantaged socioeconomic background. But the CDC says that trauma, up to 2/3 of US children have experienced one type of serious trauma, whether that is a physical trauma or like physiologically, they could have something traumatic, or psychologically and emotionally. So trauma is considered actually the largest public health issue that our kids are facing. And that was from the CDC in 2019. So with that in mind, I thought it was really good that we know some ideas and strategies of what we might see out of kids who've experienced trauma and what to do. There's one thing to kind of be aware of, is that trauma can sometimes be misidentified or misdiagnosed as ADD or ADHD because they have very similar symptoms, outbursts or like lack of focus, wanting attention, those types of things, mood. So there's quite a few similarities with some of that versus trauma experience. It's unclear yet if there's a true link with experiencing trauma and then developing a learning disability as well. So just because a student might have learning disability does not necessarily mean it came from a traumatic experience or vice versa. Generally, you're going to encounter a student who might overreact daily. They might have negative outbursts, aggression. They could have some physical signs like stomach aches or headaches. They could appear sad, inappropriate socially, trouble with kind of functioning and focus or self-regulating, and they're typically going to fall behind in their classwork. So the most important thing to help combat that in your classroom is building a relationship with that student, which is kind of a generic hot button term we hear all day long. And, at least my building was very much build relationship, build relationship. So what does building a relationship mean? Because it's kind of vague and it leaves it up to just like your instincts and what you think is building a relationship. So it was suggested that if you find something that works with a particular student, like, Jimmy likes baseball or whatever, and you build on that relationship with him by talking about baseball every day, should be documented somewhere in his profile or whatever system you guys might use, or let his case manager, if he's got an IEP or something like that, know what you do with him is working, so that future teachers would have an idea of what things help build a relationship with that kid, because that is the most important thing to foster that safety environment. If kids don't feel safe, they are not going to be very successful in learning, is what the data says. So just to kind of wrap that up, you should, to provide that safe environment, provide predictable, consistent interactions in your classroom with the student that are positive based, and make sure you're following through. Typically, a kid who's experienced trauma is because an adult has not followed through with something that they said they would do for them, or they've just, lost their trust in adults. So they automatically distrust you. You have to build a relationship in order to gain their trust. By building relationships, you're providing a safe environment, which thus allows for the learning experience and for them to hopefully gain those necessary learning skills that they need. So that was kind of my takeaway. I thought it was all really interesting. I think the main point being that 2/3 of kids have experienced trauma in some way, according to the CDC. So definitely a good resource. And I think we can now say, based on COVID, probably 100% of kids in the last 2 years, year and a half, whatever it's been, have experienced the trauma of COVID, whether that is a short-term trauma. Not every kid is going to show signs of trauma necessarily, but it's definitely something that they have dealt with. So those are just some kind of strategies and things to keep in mind on what to do moving forward.
That was great, Teresa. Thank you. And
Thank you.
sorry, I overdid it on my research and it was way too long. So
Oh,
sorry.
no, you're good. You're good. It's always better to be over prepared.
Okay, I guess I'll take it next from there. So I kind of jumping into, I don't know, I guess in some regards today, kind of a long, dark rabbit hole that most people don't kind of want to go down in terms of dealing with racism in schools, kind of racism in general. I found a really good article actually from Rick Wormley, probably not saying that right, but it was actually with, and he's an author for the Association of Supervision and Curriculum. Some of the things that stood out to me with his work, his articles, the first part is creating open forums and not being in the silent majority, kind of bringing the issue to light, being able to talk about it and have that open dialogue with it. Now, that does come with some kind of disclaimers. He does say, hey, start in small groups, kind of start in those cohorts and build from there, kind of once everybody gets that kind of easy feeling or kind of more welcoming feeling about being open about it. One of his experiences that kind of drove him to that method was when he was presenting to a group of teachers. He kind of broke them from the presentation for a few minutes. He overheard a couple of them talking about when we get that darky out of the White House, we'll get this country back the way it should be. One of the other women in that group replied and was like, yeah, you got that right. And he goes, I didn't say anything. I don't agree with that point. He goes, but I didn't say anything. And that's kind of what started firing off his work in terms of getting that open dialogue, that open forum into schools, with our staffs, with our students as well. One of the big quotes that he throws out there that he put in there, and it comes from Nelson Mandela. It was from 1996, which right now sounds like a really long time ago, especially after the last year. But it goes, "Freedom is indivisible. The chains of any one of my people were the chains on all of them. The chains on all of my people were the chains on me. The oppressor must be liberated just as surely as the oppressed." I thought that was something to me kind of stood out, especially kind of in today's age, today's everything going on, social media, everything around the world. That's something that all of us can look at and kind of use to go forward and hopefully kind of come together in our schools, in our communities, and everything that we do. Kind of my second big point here was kind of the staff review evaluation piece that he talks about. He talks about training the staff. And like I said, starting with those small groups, those small departments, and then building to kind of bigger settings within the school, within the staff, as more voices are being heard and people are kind of more comfortable having that tough conversation. As well, some of the questions, some of the prompts that he suggests throwing out there include things like just straight up asking, does racism exist in our schools? I know for me, we're about 45,000 here in the city of Hutch, and our district itself is predominantly white. It's about 79% white in our buildings and our schools. Our next biggest group is about 21%, and that's with the Hispanic population. After that, it goes, it's about 6% African American, and then the rest is non-identified or other, as selected on different forms and state documents that we go through. So it's something to kind of look at, something to kind of discuss. I know we also have kind of the divide of, okay, if you're north of the tracks or if you're south of the tracks type of thing, as well, that goes into that. A couple of the other questions as well include, how can we counter negative stereotypes? Are we responsible for teaching students and colleagues ourselves to be able to recognize and confront, and just having some of those dialogues as well. Lastly, the third kind of major point that stuck out to me was the immersing everybody, students and staff, in different learning experiences. And kind of that thought that, we can have the dialogue, we can have the talks, but if we don't have those experiences, or at least kind of simulate those experiences, we can't make it bear fruit. Some of the examples that he uses is using fiction and nonfiction, whether it's, short films, documentaries, books, to kind of outline some of those different situations. Could also be role plays or kind of simulations, which could get challenging just based on, age groups, maturity levels of students as well, but could maybe be a staff activity that you could do. Could also have your class, that kind of conscious issue, maybe a reflection on a perspective on an issue that you kind of get their feedback from and kind of their stance on it. Another one, which I kind of found kind of weird, but I get it, kind of weird, was exposing students to artworks and contribution of many different cultures, and kind of bringing in different pieces of art, different pieces of work that people could see, others of different cultures, of different backgrounds, displaying their abilities, displaying their livelihood, their lifestyle, as well, and having students respond to those artifacts as well. Otherwise, kind of short, kind of sweet, but I know we're kind of crunching on time here now.
All
Well,
right.
Oh, sorry.
Go ahead.
Oh, I was just going to say that I found that to be really interesting, and I can see the thing with the art. And just because, so I'm a Spanish teacher and I take my students abroad, and it's interesting because they only know one thing. And so when they go abroad, they do develop um, a, a like for these other types of art or whatever it is, living in the culture that they didn't have before it. They develop an appreciation for it. So I can see how that relates.
Yeah, and I think also the point about dialogue was really like you mentioned before that dialogue can happen, you need to kind of build that relationship. That trust has to be established amongst the cohort or the group or the staff or whoever before you can really transition into the, respectful dialogue about a very hot button big issue in the world, not just education right now.
Sorry, give me just a second.
So, yeah, I mean, really, I think we can see that trauma, racism, COVID, like it all comes back to safety in some aspect. So I feel like we've handled more of the emotional, maybe some of the physical and psychological, and now Katie will handle the lab safety, the fun one, man, the legal one.
Yes, I think it's great how we kind of all chose different aspects of safety. If you really break it down and look at it, we're covering several different domains of safety. Jennifer and I did more of the physical safety, where you guys did more of like the socio-emotional implications of safety and that mental like headspace, which I think is kind of interesting to look at safety as a whole. So I kind of did my research. I live this pretty much every single day. Before I went into education, I worked in healthcare, and then I now teach middle school science. So lab safety is something that I have fully immersed myself in over my 4 years in the educational world. I was a long-term sub for a high school chemistry class, which is where it all started at Hayes High whenever I was doing chemistry and honors chemistry for their teacher that was on maternity leave. And they really kind of threw me into it. And there's a lot of things that I, as an educator, never realized that go into lab safety. I had only ever had that student perspective until 2018. And there are several great resources. One of them that really I always refer people to, especially if they are a STEM or a science teacher, is NASTA. And they have different levels of information and safety acknowledgements for elementary, middle school, high school, all different disciplines from STEM to biologies to chemistries, shop classes. And it also gives you resources on who to contact to help you as an educator keep yourself protected, because it is actually a federal act where you are required by law to keep a physically safe and actually emotionally safe classroom for your students in the science setting. And I actually did my training through Flynn Scientific. It's a 7-hour course that you get credit for. Takes, I think, about a day and a half, 2 days worth of information and videos along with some tests that you have to take, but you actually get certified in it. And it covers things from physical safety to even some of that social safety, because if you're thinking about it, there's several different approaches on how to conduct an experiment and ways of thinking, and making sure that those students are protected in their ways of thinking is also part of the job, and making sure that that bullying aspect is not going on. We all know that that's also one of those ACEs that we all get to talk about whenever we have those professional developments. And it also kind of, they had a new one come out over the course of the last 2 years. I know I got information on it at the end of last year and what they were trying to amplify for COVID. And it changed lab procedures drastically for COVID and procedures on what you could and couldn't do. I know I did a simple activity with my kids, and it was supposed to be like designing an atom with protons, neutrons, and electrons with marbles, because I see so many students a day, which probably nothing compared to some of you guys. I teach in Russell, Kansas. My class sizes are 25, so relatively small actually, but 125 people touching like a pile of marbles. I had to do bleach baths for 3 days over the course of our like hybrid schedule so everybody could complete the activity, and it was a lot to try to keep everything disinfected. And I I'm really grateful that they gave us the resources on how to do that. Another thing that's important is making sure the kids understand the rules and are demonstrating the rules to 100%. One way to do this is I have them actually sign a safety contract. I get a parent signature and a student signature on it. I keep it for 5 years. Because my kids are in middle school, that gets them over the age of 18. And one thing that was recommended to me is to join KNEA, because if something ever did happen, I believe they said students have until the age, I would have to go back and ask one of my senior PLT members, but I believe they have it until the age of 20, and they can actually go back and take legal action against you. And so keeping it records until they're at least 18 and graduated is one thing that was recommended to me. So I have binders over the last 3 years of safety contracts that have been signed on paper. If I could find a way to do that digitally, I would love to, but I think there's too many authentication errors on that, too many forged signatures. But I think it was interesting as a group how we all looked at different aspects of safety. And I kind of want to talk about that with you guys and see what your guys' thoughts are.
Yeah, well, I teach science too. And
so do you know how long it is that where they can go back and take legal action? Is it until they're 20 or is it until they're 18?
I don't know. I actually am learning. Well, this year was crazy to start teaching, but
oh, this is your first. Okay.
Yes, this is my first. So I had interestingly enough, no admin, no department head, no anything on legally what I was supposed to do lab wise or not do.
Wow.
I just had to hope I knew it or looked it up before I decided to do a lab.
Well, you want some resources, I would gladly send you over my stuff that I have.
Yeah, I mean, I taught physical science, but I'm more on the biology side, but that can touch into, you have to be careful when you're talking about gender. You have to be careful when you're talking about race. With
biology,
COVID.
yes. Yeah, biology has a lot of hot topic words in it that people really don't think about. That's one thing. Part of my curriculum, I'm a 7th and 8th grade science teacher, and I get to cover human body as part of mine. And it has a lot of those buzzwords, and kids have opinions and they want to share them and they love to discuss and debate it, but making sure that you provide that safe classroom space so everybody feels like they have that equal protection in your room kind of goes back to building relationships.
Right. So it's just definitely like you got to lay those foundations early on in your classroom to keep promoting the safety aspect and the positive interactions before you can really dive into a lot of these topics. And COVID was very hot button issue. Everybody wanted to debate. I taught mostly freshmen, so it was very, very hot topic that oftentimes could get a little out of hand. So we would have to back it down a little bit and change topics, as any of these really could go that way.
Well, it's kind of like what Dalton was saying. I feel like also like in biology, some of those minority groups aren't necessarily equally represented, and making sure that you're able to get them equal representation and include them in the conversation. And even those socioeconomically disadvantaged kids too, they're a lot of times we know that those kids are also at like lower reading levels in like biology, chemistry. They're going to be harder concepts to understand, and they're taught usually with a language that's above grade level in my experience. I just actually did a textbook evaluation for my textbook and realized my 7th grade textbook reads at a 10th grade level.
Oh, wow.
Yeah. And it was very shocking to me, and I now kind of understand why my like socioeconomically disadvantaged kids who didn't have those resources whenever they were learning to read, like in grades K4, are now struggling to read to learn, especially because it's so hard and so much more advanced than their current grade level.
Yeah,
Makes sense.
it is pretty wild to think of all the factors that go into education, but
I know.
particularly like what we've discussed, safety. So great points everybody had. I think we can kind of wrap it up. I don't know if Jennifer or Dalton had anything else, but otherwise, great working with you. We get to do this again in a couple weeks.
I
Yeah.
know.
Very good. So yeah, no, I think that this was great, and I appreciate all the insight that you guys have given. And one thing that I'd like to point out that Caitlin or Katie had said was just about um, safety doesn't just mean physical, or it doesn't just mean emotional, but there are a variety of safety concerns that all have to be taken into consideration, especially within our school systems. And I thought it was neat how we each picked different ones and were able to go over those together.
Yep.
Yeah, and then I'll just throw in to Teresa's with the CDC with 2/3 of children having experienced trauma. As crazy as it sounds, I was at a place a couple years ago, and I thought that number would be low at that place. It sounds really bad and probably not politically correct, but it's almost kind of one of those things. It's like the kids that we had there were raised by wolves. A lot of single parent homes, a lot of kiddos that didn't have much. And what we did with those kids was we were the only like steady thing that they had in their life. There's it's in a way just sad to see some of those, and it's kind of one of those things. To me, that's why I do it. I mean, that's why I think a lot of us do it, is like you said, build those relationships and kind of hopefully they graduate, they are really successful because of the impact that education's had for them.
And those relationships are so important. I see it all the time with my students, and I agree with you, Dalton, that there are more kids than we actually think that have been through some sort of trauma, whether it's emotional or physical, whatever it is. But we can pick up on the cues that Teresa identified in her report. And again, it's so important to have those relationships with the kids, because like you said, this may be the only stable thing that they have in their life.
Right. Okay, well, great job. I'm going to pause here.